Good morning, friends, and happy Thursday. It's so great to see everybody. My name is April, and I'm with Medwell Health and Wellness, and I'm here with my partner in crime, Emily Waxman, as we bring to you live Medwell Unscripted. This is our favorite day of the week. Would you agree, Emily?
I sure would. I've been looking for it since last Thursday.
All right. So, friends, I'm really excited. We have some very special guests to share with you today. And as you know, we've been kind of going through talking a lot about breast cancer awareness and the power of medical cannabis in the treatment. So, great to see everybody. Just some housekeeping, friends. We are live to you on YouTube, Facebook on our Medwell, Florida, as well as our Medwell, Massachusetts. And today we are test driving LinkedIn Live on my personal profile. So hello to everybody. If you have a question or comment, please drop it in the chat. We will be sure to answer it. If you are catching the replay, please do leave a comment or a question because we're happy to get back to you and answer that. So, all right. And then one last thing, technology, friends. We are live, so you may have a delay. There may be a hiccup. And even if our guests have a hiccup, it's okay to come back in. So live makes us more human, right, friends? So if we run into technology difficulties, just so you know, we will make sure to come back on. So as we get started, today we're talking about the patient connection and journey through breast cancer. I'm going to start introducing my guests. We have Mikayla Fisette, Senior Manager, Marketing, Communication, and Events from NETA. Good morning, Mikayla.
Hey, everyone.
And we have our very own Itasha Daniels from Medwell. Good morning, Itasha.
Good morning, everyone.
All righty. So, let's get started with some introductions. Emily, I'm going to let you know what you've been doing in the community. You have a lot going on. I know we have some table events and some special things happening. So why don't you give us a share of what you're up to this past week?
Of course. So you will find me all over the place these days. You can find me at different dispensaries, or you can just find me out and about in the community, making sure that I am getting all that education out there to folks, making sure if you have any questions about the medical program or why you would want to enter the medical program, I will be there to be able to help you with that. And you can always approach me, and anyone for that matter at Medwell. We just absolutely love being able to help folks along the way with their journey in whatever capacity. So certainly make sure you stop me and say hello if you see me out and about.
Awesome. All right, so Mikayla Fisette is from NETA, and she recently, congratulations, Mikayla is like a newlywed by like not even 2 weeks, I think, right?
Oh yeah, thank you.
So Mikayla, tell us a little bit about what you've been up to, because I know your role at NETA has expanded over the past 6 months. So love to hear what you're up to.
Yeah. So I've been with NETA. I'm actually celebrating 7 years next month, which is crazy to think that amount of time has passed and being in the cannabis industry. We actually just celebrated 100 years at the Brookline Bank building. So where NETA is hosted in Brookline, the building itself turned 100. So we had a big celebration yesterday with the chamber and some folks from the town, and offered dollar pre-rolls to the first 100 customers. It was a really fun and special day to get everyone involved. But mostly, out and about, similar to Emily, is out and about in the community, making sure that people know about NETA, know about our products. We've been doing a lot more events, which has been really great, hosting pop-ups at our dispensaries. So customers and patients can learn about the brands that we have on our shelves. We actually have a new brand launching very soon as a sneak preview. Look out next week for some new products that are NETA produced on our menu. Wow. And we're very excited for some of the upcoming events throughout the rest of the year. Harvest Cup is a big one for us in November. So we're very excited to interact. Again, I love this one because it is very customer and patient focused versus business to business. Don't get me wrong. I love my industry people and connecting with all of them, but I think it's so great to gather all of these different dispensaries and producers and cultivators together in a single area and have everyone get to introduce themselves and interact with the brands and learn more and ask questions. And so we're really looking forward to that.
Awesome. Awesome. Well, thanks for being here. That sounds exciting.
Yeah.
All right. I'm really excited to share with you Itasha Daniels. She's actually one of our Medwell teammates here. And she has been, she's been on a journey with breast cancer, and we're thankful and grateful. She's going to share a little bit about her story today. But Itasha, I want to just tell everyone a little bit about what you do at Medwell, and kind of just a little bit of background would be awesome.
Absolutely.
And Itasha, we can't see your beautiful face, so can you just
I need to sit it up a little bit.
No, the other way. Now you're hidden behind the little med. Oh, there you go. Okay, now I can see that gorgeous face of yours.
Okay. So for Medwell, I'm actually a team lead here for the Somerville location, but I kind of take care of the North Shore stuff as well for any of our MAs, and just support any of the other team leads and just my entire Medwell team in general. So day to day, checking patients in, that kind of thing, getting those folks connected to either recertifying their medical card or taking them through the steps of getting their medical certification for the first time and things like that. I'm a single mom of 3 girls, 10, 12, and 4. Yeah,
Wow.
a little crazy in my
You have your hands full.
it's a little crazy in my household, but we make it through. But I'm so excited to be here today and to share my story. So I thank you guys for the support, for sure.
We're honored to have you here, Itasha.
Yeah, thank you. Thank you. All right. So as we get started, I actually just wanted to share, we're talking about Breast Cancer Awareness Month, but kind of just think of this stat, friends. 1 in 8 women in the US, which is about 13% of the population, will develop invasive breast cancer in her lifetime, which is an insane number. I was actually reading recently an article talking about back even in 2000 and where we are in 2022. And we do have a lot of preventative, we have our mammograms, and we actually had a guest, Nicole, a few weeks ago that was talking about that not even all states make it a requirement for mammograms. So that number is staggering. And I think what I've really loved most about kind of Emily and I talking with all of these wonderful ladies, kicking cancer's ass and providing wellness in the community, is really bringing awareness, because the more that we share and the more that we talk about it, the more that we can help people. So yes. All right, let's get started. Let's see, Itasha, if you are comfortable, I'd love to share, if you don't mind sharing a little bit about your audience and a little bit about with our audience, your journey. I know, I'm not sure if you were diagnosed with going in for regular checkups, if you found something, and sharing a little bit about the backstory. And of course, whatever you're comfortable with, we appreciate.
Yeah, absolutely. So I was diagnosed with breast cancer earlier this year, roughly around March. And it was literally a routine exam. I went in for a doctor's visit, and she was like, "Oh, hey, it's time for you to have your annual mammogram." And I was like, "You know what? Okay, let's schedule it," and all of that. And went in for the routine mammogram, all of that. And they had called and said, "Hey, we want you to come back. We found something." So they then took a biopsy and tested and found out it was cancer in the left breast. I was grateful enough that because of early testing and early detection and things like that, I had surgery in early May. So was out of work for a little bit, and had it removed completely, and been cancer-free since May 11th. Woohoo! Which is exciting to just be here for my girls, and be here to share my story with other folks, just to let them know, if you are afraid to be tested, or I know it's a scary situation, but knowing is literally half the battle. It really, really is half the battle.
So true.
Yes, absolutely.
So true.
And so did you end up having to have you had surgery? Did you need any radiation or chemotherapy or anything?
Yeah, I did about a little over a month of radiation after surgery. And radiation went well, and all of that good stuff. And then, there is still medication that I need to follow up with for the next few years. Routine exams, continuing on in my cancer care, my after cancer care.
Awesome.
Itasha, so does that mean that you'll need to be checked every 6 months or 12 months? Did they tell you what is really the plan for you at this point?
So at this point, because I'm still on, I'm new to this medication, so it'll be every few months that I actually check in with the provider just to check blood levels, all of that kind of stuff. But it's a journey for a long while. I will have my cancer medical team for some time.
Gotcha.
Sure.
Okay.
Awesome. Well, everyone is loving you here in the audience. Awesome. Thank you so much, Itasha. Now, Mikayla, you must see, lots of different people that come in with cancer diagnosis, and I have no doubt with breast cancer diagnosis as well. Talk a little bit about your experience in working with patients as they come into your locations and kind of finding that wellness care.
Absolutely. I think that a majority of the time, I think that people are learning a little bit more about cannabis and its use, and I think that people are understanding that there's no quick fix or that there's no product, at least for now, that we've seen that can say X cures this cancer. So at least there is a less of a learning curve these days, but there is still of that. There really isn't anything that directly is going to cure it or to reduce it. I think that cannabis generally can help, but it's a lot of symptomatic relief. And that's how we have to shape it with patients when they come in. What symptoms are you going through? What can we match you with for products? Ultimately, too, we are relying on what their doctor is suggesting and recommending that they actually try, which is why I think it's a great program that's been set up here in Massachusetts. I really advocate that everyone become a medical patient. So there's discounts, there's promotions, there's ways to get some of that money off, especially where cancer treatments are so expensive. So usually when a patient walks in, and they are going through either cancer treatments or they were just diagnosed, usually there's a lot of anxiety. There's a lot of sadness. People are scared. They don't know what their future is going to look like. So finding products that can help calm them and just at least get them back to that homeostasis. Like, let's just get you down to a calm state so you can start thinking about and planning, the next steps in your treatment. And, especially if you have families or friends, how can you make yourself at least in a sense of calm? I don't think, the cancer patients that I've seen and worked with, I don't think there's ever a calm, but at least some way to make it more tolerable. And then we can go through any other sorts of symptomatic relief. Is there pain? Is there discomfort? Is there, appetite stimulation that you're needing help with? I know that when my aunt was going through, she had stage 4 breast cancer. She just wanted to eat and not have it taste metallic-y. She was going through chemotherapy. She was taking at-home medication and, trying to find her biggest thing. My mom made her brownies. She got really relaxed. She felt so mellow. She laughed, which was not very common during her whole treatment, which was great to see. She wasn't a big laugher anyways, but it was great to see that humor come out, even in turmoil. And ultimately she was able to eat and just feel comfortable and at least feel at peace in that moment and, try to at least piece together and rationalize what her future looked like. So that's a little bit of what we'll get. And ultimately it's just providing them comfort when they're there. They're coming sometimes to a dispensary out of desperation. They don't want to do chemo. They don't want to do radiation, or maybe they are, and they're just sick. They're losing hair. They're freaking out. We can be there to just be that person they vent to. Itasha used to work for NETA, and our customers and patients loved her.
Oh, I didn't know that. That's awesome.
Yeah. We used to have customers and patients specifically line up for Itasha. How she made them feel. And that's so significant, when a person can turn to a guide or a bud tender or whatever, the dispensary calls them, and turn to them as their person of comfort. That's a big portion to all of it, is making them feel heard, comfortable, educated. It all is a whole package deal.
Yeah. Awesome.
So true.
So Itasha, let's talk a little bit. So you have obviously you're in the industry, in the medical cannabis industry. So you already had some insight too. And I didn't realize you work for NETA. So you are like very well versed, and then obviously on the medical side of getting your card. Let's talk a little bit about how you use medical cannabis as part of your treatment program, if you don't mind.
Yeah, sure. So I initially used to smoke a lot of flower before my diagnosis, and at the method and with the actual product that I used was nicotine based, font dose, things like that. So after my diagnosis, like I needed to I know that I needed to still have my medical cannabis, but I just started to figure out different routes of making it healthier for me to consume. So I went to NETA for chillums. I also runs clinics for chillums as well. Um, I tried to stay away from the edibles, but there was an edible that I actually liked, and chocolate from that is one of the things that, when they finally came with the milk chocolate, I was definitely a fan of that. So now it's just a matter of just medicating differently. So medicating more safely for me. Like I said, the raws, chillums are great. The edibles are great. I even dealt with some of the topical stuff. The LA lotion from Netta is great. Definitely helpful in some of my scar recovery and pain and things like that. So those were definitely those are the things that I've definitely kept in regimen to just getting back on my feet and feeling better, and just in everyday kicking cancer's
I love that. I love that. Awesome. Thank you so much. So, so the edibles, so, like Mikayla was using the example, or not, she was sharing her aunt's story and kind of that metallic taste. Did you find that as well?
No, thankfully, just because I didn't do it was just the radiation that I dealt with.
Okay.
So
All right.
I didn't, I'm grateful that that was a part of it that I didn't have to deal with. But definitely a lot of pain, a lot of the anxiety that Mikayla had said, a little bit of depression and things like that. So definitely the products had helped into some of the edibles helped to ease the anxiety so that I was able to sleep and I wasn't up with my mind racing all night long. And just
Now, oh, sorry, I don't mean to cut you off. So with radiation, I know the skin can be irritated. Did you use any patches or anything like that?
no, just definitely, like I said, use some of the LA. I definitely use some of the Salvit from Revs as well. Just for, like I said, for pain purposes and things like that, just for overall just comfort.
That LA lotion is just an absolute godsend. I mean,
Yes.
that is just, I have to say, one of the best products that I think are on the market right now. I mean, it's just incredible. I talk to so many patients that get so much relief from that.
Mm-hmm.
So that is that's a great one.
It is.
My 95-year-old Nana uses it for her arthritis and her hips and her knees, and I'm trying to push Netta. We'll see if it comes along, but she's requested a vat so she can just dunk her body in it. And she's good. So stay tuned for the vat lotion. Hopefully our innovation came
That would be wonderful. Yeah, let me know if you have any luck with that. I might be in line behind her. That's great.
Mikayla, what do you see for products? So that you were talking a little bit about kind of your aunt's journey, but what are kind of the more common products that you see that medical patients use?
Yeah, I really do see a variety. I think that our dose cubes for medical patients are huge. Alongside the aloe lotion, I would say that dose cubes are probably the number one seller. They come 100 in a bottle, 5 milligrams a piece. You can choose a sativa, hybrid, indica, or 1-to-1 variety. So there's an option for everyone depending on what time of the day you're using it for or what you're looking to use it for. And they're easy to even cut up and do a smaller dose, which I think is great because some patients do have a higher sensitivity to some of the edibles. So these are a great step one. And there's so many that they are able to last. I've also found a lot of patients turning to tincture. I think that it's just an easier product to process. It's 1 milligram to 1 drop, so they can titrate incredibly slowly. They can fine tune their dose. So if they've never done an edible before, if they've never consumed at all, they can at least get an idea of how they'll feel very slowly. And that's a similar product where it comes in a bunch of different varieties. We have sativa, hybrid, indica, CBD, dominant. There obviously is still THC in there, but then we have a 1-to-1 ratio of CBD and THC. And then we actually, for medical patients, have a THCA tincture, which we've heard, I've used it personally, but particularly with patients that are nauseous or having anxiety, this one seems to be a really effective product. And the onset is 15-20 minutes, which is really great. We also see, vapes, we see flower. We do see a mixture. I think that patients, even if they're going through treatments, they do turn towards flower. It's just, it's immediate. When you're having that, oh crap, I'm having a panic attack. Oh crap, I feel so nauseous. Oh my gosh, I'm in so much pain. You want that. You don't want to eat an edible and wait 2 hours. To Itasha's point, I think that the edibles are great for keeping you asleep, keeping you sound, so you don't wake up and you're anxious or nervous, and you're able to sleep peacefully if you have pain in the middle of the night. But especially for that immediacy, they've even turned towards vaporizers, which have been really great. PAX has a nice flower vaporizer. So if you didn't want to deal with distillate oil or nervous about how strong that might be, they have flower vaporizers. But then, we also have our regular distillate based cartridges, which are great. They're so convenient. They're discreet. For some people, they'll put it right next to their pillow so they can take a little puff before they go to bed, or if they wake up, they can take a little puff and go back to bed. So it is a mixed variety, but I would say it's a lot of tinctures, the lotion, edibles. I mean, it really is a mixed bag.
Right.
Which is great, because it means that there's something for everyone. The more variety that we see and the more that customers and patients are buying different products, the more that we stock on our shelves, because we want to make sure that if they come in and they want, a salve from the Healing Rose, for example, because they love the ingredients that are in it. They're very transparent about how, they're natural, and the testing and everything, which is so important. We want to make sure we have that. Or freshly baked. A lot of their edibles are more, symptom generated. They have some sleep ones. They have some for daytime and energy. So if people love those, then we want to have those on our shelves to make sure that they feel like they can buy everything they need in one-stop shop. So that's been really great too.
I think I saw that they made a specific breast cancer one too, Mikayla, right? That is being sold at your Franklin location. Freshly baked?
Yeah, they have one, and I'm pretty sure all of the proceeds or portions of the proceeds are actually going to go towards breast cancer awareness or research.
Yeah,
like that. So
that's wonderful. I'll have to check that one out.
Oh yeah.
Itasha, what advice would you give somebody that was recently diagnosed with breast cancer? And you know what, I just wanted to mention, before you answer that, because it's part of your answer, if you don't mind, is kind of what was your doctor as part of your wellness plan, and using medicinal cannabis for part of your treatment?
Well, part of it, she was like, I prefer not, just because she was worried about the smoking, because I'm a predominant smoker. But I assured her, I was like, listen, I've done my homework and made sure that, I said, I only smoke medical cannabis. So, it goes through a rigorous testing before it even gets to the shelves at the store. And just like I said, just changed up what I actually rolled my flower in. So the raw papers, or like I said, the chillums are just, a piece of glass that you can smoke directly out of, and there's no additives, no funny business or anything like that. So like I said, initially she was like, not so much, but and even after I told her, she was like, well, I know that it helps. You know what I mean? She was on board just because she knew that it helped.
Sure.
Before my diagnosis, but it was going to be crucial in my recovery process.
Awesome.
Surgery and all of that good stuff.
And it's been interesting as we've been doing this series. We've had a lot of trailblazing women kicking cancer's ass, and their doctors. It's been mixed bag. Would you say, Emily? Like some are like you should try it. Yeah, it's been a mixed bag.
Yeah, it definitely is. I'm always thrilled when I hear that women have found support with their oncologist or with their doctor when it comes to medical cannabis. I think it's really wonderful that they're starting to think outside the box a little bit. So, and I think it's just a benefit to the patient, to be able to get some further relief for themselves as they're going through this. So it is nice to see, for sure.
My suggestion for someone who's recently diagnosed with breast cancer is go through the feels. Like you got to go through the feels of whatever it is that you're feeling, whether it's angry, sad. You just got to go through the feels and get you a super strong support team. Those are the key things that literally help me get out of bed every day when it.
Which I think you have a lot here on our
Yeah.
live. Yeah.
For sure. My cousins, my brother, my sister-in-law, my Medwell family, trust me, get you a super strong support system. Just so, when you need that swift kick in the pants to say, hey, listen, we're all here and we're all going to help you fight this.
Awesome.
Great
Thank
advice. I think that's been a popular answer that we've heard to April, that
definitely.
We, certainly want to make sure that folks are getting the support they need from, not only their loved ones, but from their doctors and others around them. So.
Awesome. So we'll let Itasha come back in, but Mikayla, I have a question for you. Let's talk a little bit about that patient experience when people walk in for the first time into one of the NETA locations. So what does that look like?
Yeah. So we are open in 3 different locations here in Massachusetts. We have Brookline, Northampton, and Franklin. Franklin actually is going to be open for 1 whole year at the end of this year. So we're very excited. Can't believe how fast that year went. And it's just so good to finally have Franklin open. And, I feel like it was like this full 360. We started growing in Franklin, and then our final dispensary is in Franklin. And all 3 of those locations are co-located. So we do see adult use customers, and we also see medical patients. I think that, even adult use customers will treat cannabis medicinally. They have their own reasons why they don't want to become patients, but they're still there looking for relief. So usually if we see a medical patient for the first time, we'll get them entered into our system. And usually we'll ask, what did the doctor recommend for you? Because again, we aren't medical professionals ourselves. Our titles are guides, and that's literally what we do. We guide you through our menu based on usually either what you're going through, what your doctor recommends. But particularly with cancer patients, there's a lot of medications, there's a lot of medical history. So we want to make sure that we're following exactly what the doctor ordered, and making sure that there's no counter interactions or anything like that. So usually we see 2 types of patients. One patient will have a bucket of general, take a sativa during the day, do an edible at night. They kind of have like a general to do. And then we'll pick and choose based on, well, do you prefer to smoke? No. Do you want to vape? No inhalation at all. Do you want to do an edible? Do you have any allergies like, gluten, or you want to stay away from sugar? So we'll kind of get to know the patient a little bit, and then we can start going through. Sometimes, which I loved, is the doctor knows our menu, they know our products, and we get a patient that comes in and goes, I need your 1-to-1 tincture, I need your dose cubes, and then I need the lotion. We love that, because then we're just educating on the dosing, the time of the day, the onset, the duration. After that, we really just, talk about the products and make sure that the patient feels incredibly educated on what they're actually consuming, because we want them to leave confident and comfortable in what they're consuming. For a lot of people, this could be the first time that they're trying something. It could be a last resort. You know what? I've tried everything. Now I'm going to try this. Let's see what happens. So we want them, if they are especially consuming an edible or a tincture, start low and go slow, and make sure that they're not over consuming, because we don't want, a patient to try it, get overly, high or intoxicated, and then feel like, oh, well, this isn't for me anymore, because it can be, but we just need to teach them how to consume it responsibly and in a safe manner. Adult use customers, it's the same exact thing, except there isn't this doctor giving a list or advice. So we will ask them what symptoms they're going through, what kind of relief they're hoping to have. And then very similarly, we'll walk them through our menu. We'll help suggest some products, either based on anecdotal feedback, what our patients have reported. We do a great job of, everyone at NETA consumes themselves. So what have you heard? What did you experience when you consume this product? What does your family say, friends? So it's really great that, we encourage the consumption of our own products, because then we're the best advocates. Obviously, it's different for everyone. How I react to something is going to be totally different than how someone else reacts, but at least we have a base point and we can start pointing people in the right direction.
Right.
Awesome. So, ladies, this was awesome. Itasha, I think, I love that we have so many supporters of you here live. It just goes a long way to show the power in that. And thank you so much for sharing your journey. And of course, we continue many wishes of wellness. And I know the journey is not over, but thank you for sharing your story with us. It really, it's powerful, and we really appreciate it.
And more importantly, I think we should mention too that by telling your story, if anyone else out there just happens to hear that, I hope that will incent them to be proactive in their own healthcare and making sure that they're getting that mammogram once a year, and being careful and making sure, because it sounds like that saved your life, for sure.
It was for me. It definitely was for me. The mammogram, that saved my life. Yeah.
Yeah. So
and
thank you so very much.
Yeah. Thank you.
It really is. It really, for sure.
Mikayla, thank you so much. You're like a wealth of knowledge and like products, you name it. You're like, and you come off with like a list of product listings. You have it memorized. It's like embedded in your head. So always appreciate your knowledge base and everything that you share with us. Friends, in the chat, I did put a link to medwellhealth.net for if you are interested in learning about how to get your medical cannabis card. And I also included a great Cannabis 101 piece from NETA and all that they offer there. They do a ton with education and and that's why I love when Mikayla's here and kind of that breadth of knowledge, because that's what Medwell Unscripted is all about, educating everyone about the power of medicinal cannabis and how it really can make a difference in your wellness plan. And as always, Emily, my co-partner here, thank you so much for sharing and caring and everything you're doing. And I will find pink by the end of October. I'm just going to have to make a ribbon. I have t-shirts. I have so many football pink t-shirts, but like nothing pink and pretty like that. So.
I think you should rock one of those football t-shirts. That sounds perfect.
Oh, it does. All right, ladies, thank you so much for your time.
Mikayla and Itasha, thank you both. You're both amazing. Thank you for your time today.
Friends, if you are catching the replay, would love for you to put in the hashtag Team Itasha, and I'll put it in there again, and also leave a comment or any feedback. We'd love to hear from you. Have a great day, everybody, and we'll look forward to seeing you same time, same place next Thursday.